Today, I'm honored to have with me the mayor of Carmel, Indiana, Mayor James Brainard. And Mayor, thank you very much. Helped the city of New York by arranging to donate some COVID testing, COVID tests. And I might point out that although he's a Republican mayor, he donated to a Democratic mayor. So Mayor, thank you very much for being with us.
You know, Phil, at the local level, political parties don't mean very much. It's all about working with people and trying to do everything you can to make sure they have good services and things that they can, in an environment where they can live good, happy lives.
So tell me, you want to mention the name of the company that manufactures these tests?
Sure. We have a local businessman, a Carmel High School graduate, who then later served in the U.S. Marines, and young man in his early 40s, young at least to me. And I was acquainted with him. He serves on our not-for-profit board of our concert hall and theater complex in the city, and called me. He had some elective surgery centers around the country, and had to close them, of course, because elective surgeries weren't being done during the pandemic. But he converted the lab that he had, ARIA Diagnostics, into making test kits. And at the time he started, we were still drastically short of kits, I think, across the country. And, of course, I was reading everything, as were a lot of people, about how do we start identifying more people that may be asymptomatically or pre-symptomatically carrying this virus. And so we knew that testing, which had been done by a few countries, was probably the answer. We looked at Iceland, we looked at Germany, which had so much better results than France and Italy did. Iceland tested immediately about 10% of their population, apparently, and was able to come through this with very few cases. So we knew that testing was important. And so we had this new tool, and I reached out to our local hospitals and administrators, some of the medical directors, our State Department of Health. And the advice that I got from most of them was, test your first responders, which we intended to do, and our employees, and then everyone in our city healthcare system. And then we started to promote testing in nursing homes and assisted care facilities, because those populations were most at risk from this virus. And then Zach called me one day and said, the owner of the lab, and said, do you know anybody in the mayor's office in New York? And I said, well, I know Bill de Blasio, and I know some of his staff, and we both serve on the as trustees of the U.S. Conference of Mayors. And so I made the introduction because Zach Kahn felt very strongly that New York was really struggling and wanted to make these donations to the city.
And we were struggling, and we are very grateful, and you helped us at a time of need. Tell me, how are things in Carmel now?
Well, we're somewhat of a hot spot. We're not as bad as New York has been in terms of percentage of infections and deaths, but we've had our share, as most people around the country have. Unfortunately, I've known too many people who succumb to this virus, and we're doing everything we can. We've got good health care. We're part of the Indianapolis metropolitan area. Indiana University School of Medicine is a well-known school of medicine and ranked high on the clinical side. We've got good health care here, but at the same time, we had limited amount of testing, and the virus got ahead of us. So we're ramping up the testing. I've been an advocate here locally. I think we need to test as many people as we can over and over again, so that our hospitals and healthcare workers aren't overwhelmed, and give the scientific community time to come up with treatments and hopefully soon a vaccine.
Well, the city, it sounds like the city of Carmel is lucky to have you as a mayor. What do you think the pandemic means long-term for our country?
Well, I think life, as we're used to it, is going to be very different until a vaccine is developed and we have time to manufacture it and inoculate people with it. Hopefully, the time frames, we all want it to be a safe vaccine and be done with the proper controls, and that takes some time. Our city is, in our central core, is built a very dense, walkable, pedestrian-friendly area, not that much different than parts of New York City. And we hold all sorts of events. We have walking and biking trails, and all those. That way of life is going to be very different until we have time to develop that vaccine. We're trying to rethink everything the city does and our businesses do to adapt to it in the short term.
Mr. Mayor, you mentioned that there might be something else that you'd like to share with us. What is that?
We came up with one program in Carmel. I shouldn't say we came up with it. We stole it from a city out in the western part of the United States. Sometimes stealing is, in other contexts, it's called best practices.
Right.
It's called Feed the Frontlines. And we're trying to, of course, help our locally owned restaurants and also support our healthcare workers that are working so hard right now. We have 2 major hospitals in Carmel, then a group of specialty hospitals as well, and then some large hospitals on the Indianapolis side of our shared border. But what we're doing, we've raised over close to $150,000 at this point, and every day we go to our local restaurants. The contributions are deductible, and the city has supported it, and we buy prepackaged food, and then the restaurant delivers it to the healthcare workers at the hospital. So they get the advantage of a nice, well-prepared meal from a good locally owned restaurant. And we're supporting our restaurant employees and the owners as well during this time when they have to be closed. We're trying to do everything we can to support the healthcare workers because we recognize what a tough time it is for them right now.
How long have you been the mayor?
I'm in year 25.
I see. So you're a career mayor.
Well, I am. It's, New York and Indiana have in common that the elected mayors generally operate as city managers of other states, as they do in other states. So I never intended to do it this long, but I was always in the middle of something when the election came around. And of course, the staff who are dependent on your positions, and they always encouraged me to run. And it seemed like the public always wanted me to continue to. So it was not the game plan in the beginning, but I've continued to do it and continue to love doing it. It's a way to make, I think, a real difference to the people in our community.
Well, you seem like a real gentleman and a first-class guy. And on behalf of everyone in New York and all of our healthcare workers, thank you for taking the time to show an interest in helping us.
Great to be with you. And I hope that we're on the downward side of this apex that we saw the last few days.
Yes, God willing. Thank you very much, Mr. Mayor, and keep up the good work.
You as well. Thank you.